I applaud all of you. And Dr., and I knew I would blow it with one person. Tom, I don't know you personally, but obviously if you were selected, you must be doing some great things in our community. Well, first of all, let me say that I want to honor two people. You know, we don't get where we are if you don't have a solid base when you're a child. I would tell you that the person that has impacted my life, and I'm going to hit on two people. One is Victoria, Pete's mom. People don't realize that Victoria raised 3 children, 2 boys, and a young lady. And when I was a kid, I know she thought I was going to end up in Fort Grant, and heavens knows in prison. But the reality is that she worked day and night. I remember coming home after school with Pete, and we'd go over to ransack the house and see what was in the kitchen. And she always had some food. She always had some goodies for us. But she was working many hours. And by the way, she was a nurse. And she worked in the surgical department of Good Samaritan Hospital for many years. But she also taught us that it took a lot of hard work and sacrifice in order for us to get the education, or at least for Pete and Dickie to get their education, because I didn't get an education. I was hardcore. My dad used to say that I loved high school so much that I worked 5 years. And summer. But Victoria really gave us a grounding that we didn't realize we were receiving at the time, and that was love. Hers was a hard love because Pete and Dickie were hardcore knotheads. They were always fighting, and I was always trying to break them up. And you can imagine an 85-pound Chicanito between Big Dog and Dickie, which were at the minimum 110, 115 pounds at the time. But she showed us that with hard work and with love of family, that we could go to many places. The second person that taught me a great deal of love and compassion for community and to service and to always remember the dignity of the human person and everybody you dealt with, every person, whether they were bankers or whether they were laborers or whether they were, in fact, even if they were homeless. And that's my father. My father happens to be with me today. He's going to be 90 years old July the 6th, and I'd like my dad to stand up, who's a Marine and a Purple Heart recipient. Thank you, Dad. If I'm blessed to live as long as my dad, I'm going to tell our Lord that he did great things for me. I want to leave one message for especially the students and for the educators. Not too long ago, I sat in a hospital waiting room and was asked by one of the employees to help translate for a family whose son had been in an auto accident and was in intensive care. And the family couldn't communicate with a social worker, so I went with him, and I was on another case there volunteering, by the way. Volunteered because Elvira at 10 o'clock watching Univision, when I got home from a meeting, was crying and crying and says, we've got to do something about this family. So anyhow, I said, let's go. Let's go to the hospital. Let's see what we can do. So anyhow, the social worker asked me to go in the room. So I go in this room. There's this father and the mother who couldn't speak English, only spoke Spanish, and started to tell me that they wanted to unhook their son from the vital machinery that was keeping him alive because he had a brain fracture. So as I started to help translate, I made it very clear that we were also going to be financially supporting the family in order for them to help the son. The social worker turns to me and says, don't waste your money on this case. This boy is going to die. We have other cases that we may be able to utilize your money in a better manner. First of all, I was very upset, but I couldn't get angry at the moment because the end of the day, I have to help this family out. So I said, well, we are here specifically to help people like this young man who is defenseless against a system that looks at all the bottom line numbers before they look at the heart and soul of the person sometimes. To make a long story short, the hospital ended up sending this kid to Mexicali because he happened to be a Mexican and, believe it or not, had his papers but couldn't afford the health care in the hospital. So rather than to deal with trying to help this young man out, they shipped him to Mexicali. Well, by God's grace, his faith, this young man's faith, or better yet, the father's faith in this son, who was only about 17 years old, was able to get his church to support him in California. They moved the young man to a hospital in California, and now he's working, very much alive, and giving service to our community. Now, why do I share that information? And I'm not down on the hospitals. I understand that you have a business to run. But what I am saying to us, our generation, your generation that's coming up, you're going to have to use this brain power to figure out systems that provide health care in a manner that is loving and caring about individuals. And not that there aren't, but there are economic decisions many times that are made without heart and soul and concern for the individual. So I leave you with Corinthians 13. If I were to give up my body to be burned and did it without love, it would mean nothing. So you students, love, love, love.